Heart murmurs are one of the most common reasons why children are referred to see a pediatric cardiologist. And one thing I tell families all the time is that a heart murmur is a noise that we hear when we listen with a stethoscope. It doesn't automatically mean there's a heart problem, but it's our job to figure out which of the heart murmurs could indicate a difference with the heart, or is it simply a noise that you hear and the heart itself is completely fine. It's our job to figure that out, and sometimes that involves testing in our office, an ultrasound of the heart to look at the heart by pictures, as well as doing a careful physical exam ourselves. So in terms of how often to look after a heart murmur, it very much depends on what we find at that initial evaluation, and we make a plan based on what we discover. In terms of when to worry, some kids can have symptoms that go along with their heart murmurs. Things like shortness of breath or difficulty with exercise if they're older, difficulty feeding and growing if they're younger sometimes. So looking out for those things and letting us know if there are any changes is very important.